there are a few different things to understand about this question. First of all, there's a problem with terminology in understanding exactly what one means by addictive. I think a better way and a more useful way to understand what the consequences are is to ask your doctor and understand what happens or what the process is for stopping the medication. It's important to understand that not all antidepressant medication is created equal, so you can't have a simple answer to that question for all medications. There are some medications that are complicated in terms of the way that you stop them, and there are other medications that you can just stop taking without any complications. So the important question to ask is, what are the risks and what's the process for coming off of the medications? In general, the idea of a medication being addictive is somewhat associated with the idea of whether there's withdrawal in stopping the medication. Are there physical and psychological symptoms associated with coming off of a medication? And that's one way that can be useful in terms of thinking about whether or not a medication is addictive. But as I said, it's more useful to simply think about what is the process and what are the complications in stopping a medication. And it's important to keep in mind that just because a particular medication has withdrawal symptoms or is difficult to stop, doesn't mean that another different antidepressant will necessarily have the same issues. And these are things that are important to understand before starting the medication so you can make an informed decision about choosing the right medication for you.